Hi there, good morning. My name is Dr. Shehla Ebrahim. I'm a family physician with a special interest in dermatology. I have been doing aesthetic treatments for the last 22 years and I'm thrilled and excited to talk to you about Radiesse. A lot of people ask me about what Radiesse is made of, called calcium hydroxyapatite, which is synthetic microspheres of synthetic bone suspended in a hydrogel or a water-based gel. It was initially approved in 2006 by Health Canada to treat lipoatrophy, so volume loss in HIV patients. Soon it gained a lot of interest in the aesthetic industry, where it's used for its volumizing and filling capacity as well as long-term collagen stimulation. Basically, one of the main differences is that it is calcium hydroxyapatite, which as I explained before, these are microspheres of synthetic bone which is suspended in a hydrogel, compared to hyaluronic acid fillers, which are basically molecules of sugar and water also in a gel base. That's one difference. The second difference is that Radiesse comes in a 1.5 cc syringe, so there is a little bit more compared to hyaluronic acid based fillers, which is like 1 cc. The main difference is that it's a very robust filler. This is a filler that has a very high capacity to lift, and so it's really good for filling, volumizing and contouring the face. Although there are some hyaluronic acid fillers that also are very strong and good lifting capacity, this filler in particular is probably the most robust of all fillers. Radiesse has a unique chemical composition which allows it to be used for its lifting and filling capacity as well as long-term collagen stimulation. So studies have shown that once this filler is injected into the skin or right on top of the bone, the hydrogel, which is suspended in it, so water-based gel, gets absorbed in about 3 months, and then the particles of the calcium hydroxyapatite remain in the skin and the collagen wraps around it. So this has been proven by electron microscopy and biopsy studies for up to 78 weeks. So in other words, this is a really good filler that stimulates your own body to make collagen. So it's also known as a biostimulant. My personal preference, because it's such a robust filler that has a long-lasting lifting effect, I use it for both men and women who have experienced a lot of volume loss, especially in the mid-face. If they have mid-face volume loss, I use it to contour the cheeks. My favorite area is the jawline, rejuvenating the jawline. I also use it in the chin. One of the advantages of Radiesse is that it has some unique versatile properties in that you can reconstitute it and make it a little bit more dilute and inject it just underneath the skin, where it has the ability to stimulate collagen. So women who have crepiness of the skin or who have necklines can be treated with fillers, and it's a great product. FDA and Health Canada has cleared Radiesse to last up to 2 years. However, there are some huge variations and variability in its lasting capacity. It really depends on level of stress, whether you smoke, external factors, exposure to sun, your diet, your lifestyle. If you generally are healthy, have a good diet and a lifestyle, and protect yourself from the sun, it can last up to 2 years. On the other hand, if you're the kind of person who loves to sunbathe and you have a lot of stress in your life, those are factors that may interfere with the lasting capacity of the filler. So it's kind of variable, but I would say on an average 9 months to a year. The other thing that I want to talk about is the areas in which you inject the fillers. So for instance, the longevity of a filler also depends upon where it's injected. If you inject it in the chin, it may last up to a year. If you inject it in the cheeks, it will last up to a year and a half. If you inject it in the marionette lines or deep nasolabial folds, I would say 7 to 9 months. So because those are the areas that kind of move a lot and are very mobile, and so they may not last as long. So Radiesse comes from a company called Merz, which is based out of Switzerland. Their office is in Zurich. Radiesse has, of course, some on-label uses, which I just talked about, but it also has some wonderful off-label uses. So one of the off-label uses for Radiesse is women who have a lot of sort of neck bands and crepiness in the neck, where we combine it with an energy-based treatment like therapy or microneedling, and then we inject Radiesse sort of not in its thick form, but in a more diluted form just underneath the skin for its biostimulatory properties. The other areas that I like to use Radiesse is women who have a lot of crepiness, those smile lines, thin skin. with a lot of crepiness, so I use it for that. It can also be used for acne scars. In fact, I've used it many times for hand rejuvenation, especially in older women who have thin skin and prominent tendons. We also use it for temples. Also, it's not my to-go filler for temple rejuvenation because there are other fillers that are available. And of course, a lot of women are using it for underarms, the sort of flabby and crepey underarms with thin skin. So what we're doing is we're combining it with an energy-based treatment like microneedling with radiofrequency, and then injecting Radiesse again into the skin for its biostimulatory properties. Another area for Radiesse is sort of women of childbearing age who have a lot of, after birth, who have a lot of laxity in their abdomen. We use it for that, again, not on its own, but in combination with an energy-based treatment. Thank you so much for tuning in today, and I hope to see you all very soon at 8 West.